I'd like to help clear up some confusion about magnesium. Magnesium is one of the 6 core strategies in the Undoctored, Wild, Naked, Unwashed program in my Undoctored book, Why Healthcare Has Failed You and How You Can Become Smarter Than Your Doctor. So, getting magnesium right is one of the core strategies. If you don't get it right, the entire program can suffer. So, getting it right is really worth it. Well, first of all, why do we need magnesium? Magnesium is an essential nutrient that participates in many body processes, including the regulation of blood pressure, blood sugar, heart rhythm, the behavior of arteries, and lots of other processes, bone health. We've become deficient as a society in magnesium because we filter our water. We have to, right? Water is full of awful things like pesticides, herbicides, sewage, drugs. So we have to filter our water. The city does it sometimes, or we have to do it ourselves. But either way, virtually all the magnesium is removed. If you have a water softener, for instance, take a look at the instructions. It'll tell you that it removes virtually all the magnesium from your water. We're supposed to drink water from streams and rivers, right? Flowing over rocks and minerals rich in magnesium, but we can't. And so the water source of magnesium is now gone from our habits. Also, commercially produced produce, like cucumbers or tomatoes or radishes, have much less magnesium than they used to because of depletion of soil and some modern crop raising techniques. So you can partially work around that by getting organic or growing things in your own fertile soil. But if you rely to any degree on commercial sources of produce, you're going to get magnesium depleted produce. So that adds up to a long term magnesium deficiency. And this has great impact on body stores of magnesium, such as the bones, which should have a lot of magnesium, but deficiency develops over many years, and you get a reduction in bone integrity, osteoporosis, and osteopenia. So getting magnesium is crucial for your program. Now, I always like to give you natural ways to restore magnesium. So drinking water untreated is not a good idea, right? It's a very bad idea in our current world. Eating seeds is a nice way to get some additional magnesium. Pumpkin seeds, sesame seeds, and sunflower seeds are unusually rich in magnesium. Chew the seeds very well, or reduce them to a flour or meal in your food processor or food chopper to use it in your baking. And that provides about 100 milligrams additional magnesium to you. So that's one way. Not enough to suffice on its own, but one way to beef up the magnesium intake. Also, other nuts contain some, not quite as much, but a fair amount of magnesium also. We're all left with having to supplement magnesium. The limiting factor in oral supplementation of magnesium is loose stools. And that's because magnesium has an osmotic effect. It pulls water into the intestinal tract, which causes you to have diarrhea or loose stools. You know, in the hospital, we give intravenous magnesium to people, megadose intravenous, because there's no diarrhea, obviously. And that works like a charm. There are life-threatening heart rhythms, for instance, and other problems that respond within minutes to intravenous magnesium at megadoses. But we can't do that, of course, at home. So we have to take magnesium orally. So you're going to encounter loose stools with most forms of magnesium. So I try to point you towards forms of magnesium that had that least likely to happen. So magnesium malate is a good form. It's very absorbable. The magnesium water with the recipes in the Undoctored book, as well as my Wheat Belly Total Health book and the Wheat Belly 10-Day Grain Detox books, they also have the recipe for magnesium water. It's very easy. It's the best form of magnesium you can get because the reaction between carbonic acid of the seltzer water and the magnesium oxide of the milk of magnesia yields water and magnesium bicarbonate, which is very well absorbed form of magnesium. And it's the best way to get your magnesium, particularly if you have health problems that are serious consequences of long-standing magnesium deficiency, such as heart rhythm disorders like atrial fibrillation and premature ventricular contractions or premature atrial contractions, or if you have migraine headaches, or if you have advanced osteoporosis, then you ought to really seriously consider doing the magnesium water. It's very easy. Just check those recipes out. Magnesium citrate is okay. It's not as well absorbed. It has a bit of a laxative effect. So I suggest to people who struggle with constipation, for instance, magnesium citrate is a good form. Also, people with calcium oxalate kidney stones. The magnesium citrate inhibits the formation of calcium oxalate stones. So that's the preferred form for that issue as well. There's some other forms, but as we go further in, we have more and more of a laxative type effect. So I tend to restrict our choice to those. Oh, there's also magnesium glycinate, I should mention, glycinate or chelates. Those are also pretty good too. They're well absorbed. Now, dosing is confusing because many manufacturers put the entire weight of the pill, the entire capsule or pill on the label, and you don't care what magnesium plus malate weighs or what magnesium plus chelate or glycinate weighs. You don't care what the total weight of the pill is. That's immaterial. What you want to know is how much magnesium is in that pill. So even if it says the pill is 400 milligrams or 450 milligrams, only a portion of that, a small portion of it, is magnesium. And that will be listed either as elemental magnesium or just magnesium content. And you want in the neighborhood of 400 to 500 milligrams of elemental magnesium per day. If you find a preparation, let's say magnesium malate, that does not list the amount of magnesium contained, don't buy it. Buy a brand that lists the elemental magnesium. That's the easiest way. I can give you all the weights for the total tablets, but it's kind of a pain to remember all that. So the easiest thing to remember is just get 400 to 500 milligrams per day of elemental magnesium. That is magnesium by itself, not counting the weight of the malate, the chelate, the glycinate, the citrate, etc. So getting magnesium right is very, very important. When you get that 400 or 500 milligrams of elemental magnesium per day, divide the dose in two. Split it up in two or even three. That also reduces your likelihood of loose stools. Some people get a kind of a sleepy effect from it also. So if you get that, you might want to take a little more at bedtime, a little less in the morning if your tablet or capsule permits that, so that you don't get a sleepy effect during the daytime. But getting magnesium is right. Recall it's one of the 6 components in the Undoctored, Wild, Naked, Unwashed program that you must get right to enjoy the full synergistic power of the program.